In every during the pregnancy, we are talking about the two, mother and the fetus. In intranatal, again mother, and in postnatal, again mother and the neonate, because the terminology changes it. So in antenatal, mother normal and abnormal. Then again here, the terminology, it is the embryo. Up to the 10 weeks, it is the called as the embryo, up to 10 weeks. What is the product of conception? It is called as the embryo. And from 10 weeks onwards, that is from here, up to the delivery. The word for the product of conception, it is the fetus. And from the delivery up to the 6 weeks, up to the 6 weeks, the product of conception is called as neonate, right? See here, that is neonate. Now we are seeing the mother normal part, what we are seeing in the first part. Now what we are seeing is mother abnormal part. We are seeing this part of the obstetrics. Now next. So bleeding. So bleeding in early pregnancy. Now today we are yesterday we are seeing this topic, that is bleeding in early pregnancy. It may be after the delivery also can take place, or it may be takes before the delivery also. So it had maybe during the pregnancy, mother may suffer from bleeding, but depending upon the at what time the bleeding is taking place. So if you say from the previous diagram, okay. So from the from this diagram, if you see that if bleeding, it can be take place during the any time of the pregnancy. So if it takes place up to the 40 weeks, then it is called as a bleeding in early pregnancy. Here, the terminology is different. If the bleeding is here, it is called as a bleeding during the early pregnancy. If the bleeding is taking place before the delivery, then it is called as a antepartum hemorrhage, APH. This is called as APH. See, the mother may suffer from bleeding. So time duration wise, it is different. And if there is a bleeding during the delivery, then this is called as PPH. P stands for postpartum hemorrhage. What the difference?
मैम पीपीएच वापस से बताइए ना.
Okay, sure. See, during the pregnancy, mother may suffer from bleeding at any time. But if the bleeding takes place up to the 20 weeks, then it is terminology, it is called as a hemorrhage in early pregnancy. If the bleeding takes place before the delivery, then it is called as antepartum hemorrhage. And if bleeding takes place during the delivery and after the delivery up to 500 ml, then it is called as PPH. P stands for postpartum hemorrhage. What the difference? So that may be the mother may suffer from that bleeding during the pregnancy, bleeding during the delivery, and even bleeding after the delivery also. So these are the different causes of bleeding. Okay, so we are seeing the mother part of it. So it is bleeding in early pregnancy, bleeding that is postpartum hemorrhage and antepartum hemorrhage. So what are the mothers? The problems to mother during pregnancy क्या हो सकता है? It may be hemorrhage, so that is about 95%. It is the abortion, then the hydatid hormone and the disturbed ectopic pregnancy. So yesterday we have seen about this abortion part of it. So if you see the percentage wise, so this whole red part, it is the cause of hemorrhage in early pregnancy. It is 95%. It is the abortion, and the remaining part it is the hydatid hormone or ectopic. What is abortion? We have seen yesterday. The weight should be less than the 500 gram, and whatever the it should be duration. It is 20 weeks. Next, what is it? Hydatid hormone. This is the normal uterus, and this one is the molar pregnancy. That is hydatid hormone. This is ectopic pregnancy, where the pregnancy occurs other than the normal size. Okay, this pregnancy occurs other than the normal size. Then APH, third, that is antepartum hemorrhage. What is it? That is from the bleeding to the pregnant lady from 22 weeks up to the delivery. That is, if up to the prior to the birth of the baby. If the bleeding takes place, then it is called as a antepartum hemorrhage. Again, there are different causes for the antepartum hemorrhage. There may be problem with the mother. There may be problem with the fetus. The mother problem, that is the problem maximum cause, is the placenta. That is placenta previa and the abruptio placenta. What is abruptio placenta? What is the this is the placenta which is normally attached. It is dislodged from its original site. But if that placenta it is present in the lower uterine segment, so this is the lower uterine segment, and here it is the normal placenta. This is normal. This is abnormal. See, this is the bleeding. This is called as the abruptio placenta, and here the placenta is present in the lower uterine segment. That is called as the placenta previa. Sometimes there is too much of vomiting during the pregnancy. That is what we have seen in previous lectures. If it is too much of severe vomiting, then it is called as a hyperemesis gravidarum. This is hyperemesis gravidarum. This pregnancy is more than 3 months. So this is hyperemesis gravidarum from the out of the uterus. Then during the pregnancy, if there is an increase in the BP, see in this diagram what we are seeing, this BP is increased, her weight it is increased, there will be swelling on the face, the female may be having edema on the legs. See in last there is a convulsions. If that situation is there, then it is called as a pregnancy-induced hypertension. There may be convulsions. That is, what is this convulsion? Fits which are coming. HELP syndrome. That is the situation where there is too much of, if BP increases, what it leads to? There is a hemolysis, and that hemolysis leads to the elevated liver enzymes and the low platelets. That is called as a HELP syndrome. This is the part of the PIH. Sometimes there is a anemia during the pregnancy. If the HB it is less than 10 to 11 gram per cent, then it is called as a problem. That is anemia during pregnancy. Sometimes there is a problem with the abnormalities of the placenta attachment. This is the normal placenta, but if it is too much of deeply attached, then it is called as the placenta accreta. This is called as the placenta increta, or if it is even crosses the perimetrium, then it is called as the placenta percreta. Too much of deep attachment of placenta. There is the abnormalities of the placental shape. That is what we see, this filamentous placenta. sometimes there is a accessory placenta that is called as a subsensual placenta. This is the actual example of what is bimodal. That is the one lobe, another lobe. Or this is the accessory lobe it is there. So this is called as a subsensual placenta. That is abnormality of placenta. This is the battle door. Battle door. How is the door we are opening and closing it? The placenta is started from this margin, and if it is present at the center, then it is called as a center, that is battle door placenta. And if there is a filamentous to it, it is called as a filamentous placenta. Sometimes this is a ring-shaped placenta, or sometimes there is a circumambulate placenta, like a pizza. It is pizza sort of structure, so that we can think about it. These are abnormalities of placenta. Hmm. Then abnormalities of umbilical cord, that is lengthwise, cord-wise, then content-wise, then the cord insertion where it is insertion, or sometimes there is a torsion and stricture, or sometimes hematoma and cyst to the umbilical cord. See, these are the loops of umbilical cord loop. One, two loop around the neck. You can see in this diagram. That is abnormalities of umbilical cord. Sometimes the umbilical cord has a knot also. So this is the two knots, and this is the false knot, and this is the true knot. Then sometimes there is a torsion or stricture to the umbilical cord. And there is the abnormality of amniotic fluid also. So see, this is called as a polyhydramnios, huge abdomen. Too much of amniotic fluid, the fluid which is present around the fetus is called as a polyhydramnios. Sometimes opposite to it, that is the amniotic fluid, it is less, then it is called as an oligohydramnios. That is, there leads to the problems with the fetus, that what we see in the movie, that is the club foot, club hand, because of this oligohydramnios. Sometimes this is the same for how the face it is get compressed. So these are the, in general, total abnormalities which can take to the mother during the pregnancy. So out of these problems, we have finished one, that is the NVT, vomiting during the pregnancy. Now, next what we are seeing about this part. Abortion we have finished. Now we are going to continue with the ectopic pregnancy in the continuous lecture, in the next lecture. So this is the in general scenario, that is what if the mothers may get problem during the pregnancy. She may have the hemorrhage, and depending upon where when she is having the hemorrhage, whether it is in the early, whether it is during the before the delivery, or whether it is the after during or after the delivery, the terminology is different. She may suffer from that of anemia during the pregnancy. She may suffer from that nausea and vomiting during the pregnancy. Sometimes there is a problem with the placenta. Sometimes there is a problem in the amniotic fluid. And sometimes there is a problem in the umbilical cord. That is all we are going to see only in the part that is abnormalities here. See, these are the total parts we are going to see. This is the problems to the mother. That is, one is hemorrhage. Second one is the antepartum hemorrhage. Third one, it is the vomiting. Next one is it is the BP increase, that is PIH. Then the anemia. Then again hemorrhage. Again it is divided into abortion, identiform mole, and disturbed ectopic pregnancy. APH, again it is divided into two, abruptio and placenta. So out of this we have finished the vomiting part. Then next what we have finished the abortion part of it. So we have to finish the ectopic pregnancy, identiform mole, APH, abruptio placenta, placenta previa, then the pregnancy induced hypertension and anemia. So these are the total problems to the mother during the pregnancy. And out of obstetrics, where it is, see, this part it is embryo and fetus. We are seeing only mother abnormal part. Only that much we are seeing. Okay, do you have any query in this?
No, ma'am.
Okay, so this is
No, ma'am.
only a 20 part of the total obstacle. So that much part we have to cover. Fine. Okay. Thank you very much. If you have any query, please let me know so I can able to explain you properly. Fine. Thank you.